There are 64 million enrolled in Medicare and 87 million enrolled in Medicaid and CHIP. In that 19% of Medicare have Medicaid, which means dual coverage. Today we are going to see 10 important differences between Medicare and Medicaid. Before that, if you haven't subscribed our channel, please subscribe now, like the video if you find it useful, and share it with your friends. Overall, give your support to VB English. Welcome back to VB English.
First point, Medicare is a health insurance program sponsored by federal government, whereas Medicaid is a health insurance program sponsored by both state and federal government. Second point, Medicare is funded by federal government and administered by CMS Centers for Medicare and Medicaid Services, whereas Medicaid is funded by federal and state government. Also, Medicaid is administered by CMS Centers for Medicare and Medicaid Services, but it is run by state and local governments within federal guidelines. Third point, Medicare has the same program and rules nationwide, whereas Medicaid is a statewide program that vary from state to state with federal guidelines. Fourth point, who can qualify for Medicare? Medicare is for old people. Individuals aged 65 and older are eligible. Income is not a factor in Medicare eligibility. In addition to that, Medicare provides coverage for younger people with disabilities and people with end-stage renal disease. What is ESRD? Permanent kidney failure requiring dialysis or transplant, which means kidney failure. Those people may die soon. In these cases, Medicare makes no distinction based on age. Who can qualify for Medicaid? Medicaid is for poor people, children, and pregnant women. Medicaid coverage is based on income and family size. Fifth point, Medicare coverage and benefits depend on the plan you select. Medicare is divided into 4 major parts. Medicare Part A, hospital services only. Medicare Part B, provider services only. Medicare Part C, also called the Medicare Advantage Plan, includes both Part A and Part B, and other benefits not available with original Medicare. Medicare Part D, prescription drugs. Here, a 65-year-old person who has paid Medicare taxes for at least 10 years will get Medicare Part A for free. Other parts like B, C, and D are not free. A monthly premium is payable. Medicaid, unlike Medicare, is a single plan that covers extensive coverage and benefits that vary by state, though each state follows federal guidelines. Medicaid covers hospital, provider, nursing facility, laboratory, X-ray, and home health care services in single plan. Sixth point, Medicare participants pay out-of-pocket expense, such as annual deductibles and coinsurance amount. Although original Medicare covers most of your medical costs, it doesn't cover everything. Medicare pays a portion of your medical costs, and patient is responsible for the remaining amount. For example, you're enrolled in original Medicare, and you visit your doctor for a $500 outpatient treatment. Your doctor appointment is covered by Medicare Part B. Your doctor bills Medicare for $500. In 2023, Part B carries an annual deductible of $226, so you're responsible for paying this amount toward Part B covered services for the year. After paying the Part B deductible, the remaining $274 of your bill is covered in part by Medicare and in part you through coinsurance. Your share is 20% coinsurance of $54.80. And Medicare Part B's share is 80%, which is $219.20. In the same year on next bill onwards, example on the next $500 bill, you'll have already paid your Part B deductible, so Medicare will pay 80% and you will pay 20%. Whereas in Medicaid, no out-of-pocket expense for medical coverage. Participants pay little copay only for vision and dental services. Seventh point, in Medicare, eligible individuals only need to apply once. He or she no need to apply every year. Whereas in Medicaid, individuals need to recertify every year by proving they meet eligibility requirements. Because Medicaid coverage is based on low income level, every year the individual's salary may vary. The salary may increase or decrease, so it is mandatory in order to measure the low income level that every participant needs to recertify every year. In Medicaid, there is spend-down charges. Some people have too much income to qualify for Medicaid. This amount is called excess income. Some of these people may qualify for Medicaid if they spend the excess income on medical bills. This is called a spend-down charge. Let's see this spend-down charge in next video. Eighth point, are Medicare dependents eligible? Only spouses or ex-spouses are eligible. They must get their own Medicare plan. For example, if a husband has Medicare Part A and Part B, it doesn't mean his wife will be covered in both Parts A and B. His wife needs to buy her own plans. Other dependents, including children, are not covered, whereas Medicaid covers dependents. Children can qualify with even higher income levels. Ninth point, eligibility and applying for Medicare, same rules nationwide. The majority of Medicare has premiums, whereas Medicaid eligibility and application. Each state has its own set of rules for Medicaid eligibility and application. Medicaid is generally free or very close to being free. Generally, there is no monthly premium in Medicaid. 10th point, for Medicare, you can apply through Social Security Administration website, ssa.gov/benefits/Medicare. For Medicaid, you can apply through healthcare.gov or your state's Medicaid website, medicaid.gov. What is QMB, SLMB, QI, and QDWI? These are beneficiaries duly eligible for Medicare and Medicaid. If you want to know more about these dual coverage, please let me know by leaving a comment. Not only this, if you have any questions in medical billing, please leave a comment below and I will try to make a video about your request. Please like and share this video if you find it useful. Please utilize your time, and I will see you on the next one. Take care and bye.